What are kind of the mechanisms of injuries? What sort of things do we need to be looking for? Well, the number one cardinal and obvious is age. We're talking about somebody that is a geriatric person who's had 60, 70, 80 years of loading that knees, having that cartilage kind of wear down and break. We like using the phrase in our office of wear and lack of repair more than wear and tear, because there always is wear and tear, but at a certain point, whether due to an injury, poor diet, or just getting older, that repair phase after the wear is not going to keep up, and that injury is going to add up over time and create pain. A previous trauma is going to be another thing that causes a huge episode of wear on the cartilage. So think of somebody who's had a really bad sports injury, like a blown out, terrible triad, ACL, MCL, and medial meniscus blowing out. Um, or someone that was in a really bad car accident and slammed the knee into the dashboard really hard and created a lot of trauma right there. Somebody that missed the curbside, stepped off and really buckled out that knee and created a lot of knee damage. The list goes on, but the idea is some sort of trauma. Trauma is generally going to accelerate osteoarthritis. Somebody who's overweight, once again, a lot more wear and compression on the knee. And it's also more than just the wear and compression that lives on the knee as well too. It's also the fact that when you're overweight, that changes fatty as a hormonal profile, and that's going to keep people in a bit more of an inflammatory phase and prevent that lack of repair from happening at the knee. And then also job and sport related. We find that people that frequently work in construction type industries are going to have a lot of squatting and bending and loading of their knees. In sports, typically the athlete I like to pick on the most is the catcher in baseball that sits in this prolonged squat. But either way, there's a lot of sports, running with this repetitive pounding. Um, could have those that are football players that have had, like we said, a bit of a long career with a lot of hitting the gym and a lot of load on those knees over time. So those are kind of ways that the osteoarthritis is going to either sort of reasonably set in or potentially set in a little earlier.